According to the National Alliance on Mental Illness, approximately 20% of the United States population experiences a diagnosable mental illness. If you're not one of those 1 in 4, chances are you know someone who is. And so it's really important for us to know what a diagnosis means and what it doesn't mean. On today's Tea Time, I'm going to talk about costs and benefits of a diagnosis. Grab your tea and your snack and come on in. Let's get started. Welcome. I'm Dr. Tracy Dickens, a psychologist, and today I have some lovely tea and a fabulous oatmeal breakfast muffin. I'm gonna share the recipe for this lovely breakfast oatmeal muffin in the description below. I have been involved in the mental health industry for about 30 years, and I have been assigning diagnoses to people for about 20 of those years. That's a lot of diagnosing. Over time, I have recognized some costs and benefits of diagnosing. To be honest, there's more than what I'm going to talk about today, but I respect your time, and so I'm going to keep it brief-ish. And so I'm only going to discuss 4 benefits and 4 costs. And then at the end, I will tell you where I stand on this issue. Let's get started with the benefits. A diagnosis is a great, simple way to communicate to one provider to another what they are witnessing, observing, experiencing with a client. And because it's this nice shorthand way of communicating that, it allows for an ease and continuity of care. If I am seeing a client who has symptoms suggesting depression, and then I send them to the hospital, the receiving facility can look at that paperwork and go, okay, we have somebody who has a history of depression, and that gives the new provider an idea of some things to consider for treatment. So it smooths the transition from one provider to another. Next, a diagnosis gives a name to what a person is experiencing. For most of us, whenever we are recognizing that there's something different about how we're functioning and experiencing our body and how we're interacting with people in our world, we get a little panicked. Our mind immediately goes to the worst case scenario, and to be able to go into someone's office, give them your symptoms, and they say, oh, this is what I think is going on, and this is what we can do to make it better. It just immediately reduces the intensity of those symptoms. Now it's not this unnamed, unidentifiable thing lurking under your bed or scratching at your closet door in the middle of the night. Now you know what it is, and you know that there's something that can be done about it. So on to the next benefit. Connection with other people. Once you have the diagnosis and you know that other people have similar experiences or similar struggles, you don't feel alone in the world. In today's world, we have social media that has support groups for just about anything you can imagine. Another benefit of a diagnosis is that it can encourage research and the innovation of treatment interventions that can assist people in living their best life. So that was some of the benefits. Now let's look at some of the costs that a person can experience when they receive a diagnosis. Well, number 1 is that, a diagnosis can be wrong. There was one study conducted in an inpatient facility that found that 65% of the people involved in that treatment were misdiagnosed. You might be thinking, how does this happen? How do you get misdiagnosed? I'm going to give you a handful of reasons on how this can happen. Well, 1, it can be training. Everyone has a different training experience when they're becoming a mental health provider. My master's program, we practically had to memorize the Diagnostic Statistical Manual. That's the book that we use to diagnose people in the United States. Just for example, for really common misdiagnosis. I will have people that will come in and say that they were diagnosed as bipolar. And I'll say, okay, tell me more about that diagnosis. When did you get it? Who gave it to you? And they'll say something along these lines. my mood just goes up and down. One minute I can be happy, and then the next minute I can be just like really irritated, or I just want to lay on this sofa and I just want to be left alone. It's just like all over the place. I'm like a roller coaster. That is not bipolar. So your training will help you determine, is this just someone that's having difficulties regulating their emotions, or is it in fact someone who's experiencing variability in their mood that follows a certain pattern and comes with changes in behaviors over a period of time? Another thing is symptoms overlap. For example, if a client comes in and says they're having difficulty sleeping, they're having difficulties with their memory, and they're having difficulties with irritability, well, guess what? That person could have PTSD, that person could have depression, or that person could have chronic pain. Another reason that diagnoses can be wrong is cultural and ethnic differences. There are a number of cultures where having a mental illness is looked down upon severely. And so in those cultures, what you'll often find is that people will go to a medical doctor and report physical symptoms, and those physical symptoms don't get better. And it's because there's actually a mental health issue that is causing the physical symptoms, or they're kind of feeding into each other. Another cost is the historical foundation for diagnosing is still influencing how we view people and diagnoses today. A lot of people don't realize that diagnosing was a way to shame and judge and isolate people that just didn't fit the norm of society. When someone was found to be different or problematic, they were often placed in a prison with criminals. And they were given labels like insane, or like in slavery times, if a slave ran away from their abuse and torture, they were diagnosed with drapetomania. You think, what's drapetomania? It's drapetus, which means runaway slave, and mania. And when women would speak against abuse or oppression in their household, they were labeled with hysteria. And you might think, well, that doesn't happen today. We don't label people with hysteria, but we do label people when their behaviors don't fit into our cultural expectations, into societal norms. We're really quick to slap a label on that person and accuse them of being crazy or mentally ill, so we can dehumanize them, marginalize them, ignore them, just really be nasty to people. The original purpose of diagnosing, it is still very much so alive and well today in a lot of subtle and not so subtle ways. Whew. This is one that, okay, stigmatization. A lot of times we don't recognize the stereotypes and biases that we've been presented in society. And yes, we're making progress on this end in how mental illness is portrayed in movies and TV shows, but the stigma still remains. There tends to be this idea that if you have a mental illness, that you're dangerous, you're unpredictable, you're untrustworthy, you're a sinner, you're less than in some way. And yes, there are people with mental illness that can be dangerous, absolutely. But there are people without mental illness that can be dangerous. And a vast majority of people that have a mental illness are not dangerous. They're law-abiding citizens, raising families, going to work, being very influential in their world. They just have a struggle in this area. The other cost, people are often reduced to their diagnoses. And I know this probably sounds a lot like what I just said with the stigmatization, but hear me out. The person gets lost in their diagnoses. I have a lot of clients that will come in and they will say, I am depressed, I am bipolar, I am borderline. I gently correct them and say, oh, you're a person who has depression. You're a person who struggles with borderline symptoms. Every symptom has a story. And what do I mean by that? If you come in and you say that you're having difficulty sleeping, okay, well, tell me more about that. Like, is that happening every night? Are there times when it's better? Are there times when it's worse? Are you having a difficult time getting to sleep, staying to sleep? A lot of times when we give somebody a diagnosis, they anchor themselves to that label, to that title, and they lose the story, the context of their symptom. And it's up to the provider to ask them so the person doesn't just stay lost and just fuse with this label that, as I mentioned earlier, can be wrong. So with all this information, where do I stand on diagnosing? I'm glad you asked. Here are my personal thoughts about diagnosing. And you ask other mental health providers and they'll have a very different stance on that, and that's fine. This is just mine based on my experience. I do think diagnosing has a purpose. It is helpful. I mean, I mentioned some of the ways that it's helpful. All that being said, I do think there is a significant cost to diagnosing. I spend a lot of time with my clients helping them to see themselves as a person, and a person that has the power to influence the world and to leave a positive impact on their family and their friends, because they come in with the shame and guilt about having struggles and challenges in their life. And the reality is we're all going to struggle at some point in time. No one gets out of this world without pain and suffering. Jesus was very clear about that. In this world, in this life, there will be troubles. You are you. You are more than your symptoms. And we all have challenges of some kind. And even with those challenges, you can accomplish great things. You can leave a legacy and an impact on people in ways you can't even imagine. And I just think if you can do these amazing things with depression and with anxiety, that doesn't make you weak. That makes you even more amazing. For a little transparency here, my default is anxiety. I can go into some crazy rabbit holes, and I'm a psychologist. I help people every single day because I know what it's like to get in that rabbit hole and how dark and crazy and wild it can be. That allows me to empathize and have compassion with people that find themselves in the same place. It doesn't make me worse. It doesn't make me less of a person. It doesn't make me, this person is going to go off. It makes me somebody that can reach a hand down into the rabbit hole and help that person up and into the light. And so I want people to see themselves beyond just their diagnosing. Down below, let me know what your thoughts are about diagnosing, if you've ever experienced a diagnosis, if it's ever been wrong. I know I've given wrong diagnoses and I've seen wrong diagnoses with people when they come in. Please push the like button because that lets YouTube know that you want more information, you want more videos like this, and share the video. And of course, subscribe so you can come back and hang out with me for another tea time. And thank you so much for hanging around for the video. I appreciate you sharing your time with me. And until next time, choose joy. Bye.